Hello and welcome to the Trauma-Informed Birth Nurse Program, Level 1 Foundations. This program is a partnership between the Birth Nurse LLC and Your Birth Partners, a nonprofit founded by our very own Maggie Runyon. What is trauma-informed care in the first place?
Our mission at Trauma-Informed Birth Nurse is to champion the paradigm shift in nursing education. As you know, we've kind of been touching upon that really centers birthing people and their families in a safe and ethical framework for nurses. It's super important to kind of jump right into our definition of trauma-informed care. Trauma-informed care is one element of organizational change that really prioritizes the individual as the leader of their own health. It also recognizes how person-centered care shifts unhealthy power dynamics to mitigate potential for trauma found in every care interaction with our patients.
All right, moving right along. Our pillars. This is our foundation and our core of what we believe in and how we developed this whole program. As you can see in these pillars, this is the trauma-informed birth nurse movement. It's a movement where we require others. It's part of an organizational change. It's the umbrella. And underneath the foundation are the birthing people. Everything that you see inside the trauma-informed birth nurse program comes from this foundation. We're focusing on these pillars, and these also reflect our values, our mission, and our vision for this program.
I am here to walk you through your journey. So that is on the very next page. And I just want to kind of give you a little bit of a sense of where we came up with this framework. So it looks busy looking at it, and that's because it's a lot. This is a journey. This is not a straight from A to B kind of course. We are inviting you to bring all of yourselves. And so we start at the very bottom with your personal experiences. We know that we have all taken in what it means to be pregnant, what it means to give birth, what it means to be a parent from a variety of sources, from our own families, from the media, from loved ones, from our previous care. And so then we know we come to the hospital, and so much of that is spent on the policies of the unit, learning provider preference, taking care of all those big, your NRPs, and you're getting to the sim lab, and you're learning about all of these emergencies that could come up. And that's a really important foundation, but it doesn't get us much beyond this standard of helping. And, we call it that because we think there's nothing wrong with helping people. Many of us identify as helpers, as people who enjoy being able to support people in whatever they're going through. But what we found is that this tends to put us in this piece where we're kind of in the back seat. So we are helping primarily providers. We're helping promote the hospital's policies. And we're doing way less of actually listening and advocating for the individual person in our care. And so that's what we kind of want to walk through on this journey with you here in Foundations. And then we're integrating all of that into, this trauma-informed standard of advocacy. But that's just the beginning. And you'll see there that we know that this journey continues way past then. And we hope to be alongside you for the rest of it too.